Many factors influence an individual's health. Some are not modifiable, such as genetics and age, while others are modifiable. This illustration shows three categories of modifiable factors and percentages of an individual's health influenced by them. This shows that up to 50% of an individual's health can be attributed to their social, economic, and physical environment, which are collectively known as social determinants of health. Evaluating social determinants as risk factors of a population can allow for the implementation of interventions to alleviate health inequalities and avoid overutilization and unnecessary spending. This rationale behind population health is illustrated. Population health is the overall health of people in a given geographic location, measured by the distribution of health outcomes. Health outcomes such as morbidity and mortality are heavily influenced by social determinants such as genetics, behavior, and physical, social, and economic pressures. This focus led to our research question exploring what social determinants of health are associated with Allen County adults' self-reported perceptions of fair or poor health. Social determinants of health are the conditions and the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. This illustration outlines 5 domains of social determinants that are utilized in this study. The 5 domains of social determinants that will be utilized in this study are economic stability, education, community and social context, health and healthcare, and neighborhood and the built environment. The purpose of this study was to distinguish what social determinants of health are associated with Allen County adults' self-reported perceptions of fair or poor health. The study used secondary data derived from the 2017 Allen County Health Risk and Community Needs Assessment. The first question in the assessment is, would you say that in general your health is excellent, very good, good, fair, or poor? Respondents who answered fair or poor were combined into a subgroup and cross-tabulations were performed with select other items of the assessment investigating social determinants of health. The Allen County Health Risk and Community Needs Assessment is a cross-sectional written survey of adults 19 years of age and older in Allen County. Consequently, the secondary data used in this study are analyzed self-responses on a written survey form. The survey consisted of 117 items primarily drawn from standardized questions used by the Centers for Disease Control and Prevention for their behavioral risk factor surveillance system. There were an estimated 79,189 persons ages 19 and older living in Allen County. From a power analysis, a sample size of at least 382 adults would ensure a 95% confidence level. Prior to mailing the survey, an advance letter was mailed to 1,200 randomly chosen adults in Allen County. An advance letter informing recipients of the study, followed by a 3-wave mailing of the survey with small financial incentive, was used to collect information. The response rate for the general population was 41%, a sample size of 456 usable responses. This return rate and sample size means that the responses in the health assessment should be representative of the entire county. Analysis of Allen County adults who reported their health as fair or poor also reported economic stability struggles. Data revealed that 29% had an annual income less than $25,000, 32% had experienced at least one food insecurity in the past year, 44% had experienced financial stress that caused anxiety, stress, and depression, and 61% spent over 30% of their household income on housing. Educationally, Allen County adults who reported their health as fair or poor also revealed that 24% had less than a high school diploma, 39% had only a 12th grade education or GED, and 39% also felt not totally confident filling out medical records by themselves. Data revealed that Allen County adults who reported their health as fair or poor also reported that within the past year, 32% received assistance for health care, 29% had utilized Medicare, 27% received food assistance, 27% also received prescription assistance, and 22% received assistance with dental care. Of Allen County adults who reported their health as fair or poor, the following places were visited for healthcare services and advice. 40% utilized the hospital emergency room and 20% visited urgent care centers. Of the respondents, 24% received Medicaid or medical assistance, 24% also utilized Medicare, and 18% used healthcare coverage provided by their employer. Of the Allen County adults who reported their health as fair or poor, 41% reported having experienced at least one transportation issue, 33% reported feeling slightly safe or not safe at all about their neighborhood, 29% reported being overweight, and 42% reported being obese by body mass index. Experian Health estimates that approximately 68% of Americans are affected by at least one social determinant of health. Only 17.7% of respondents to the 2017 Allen County Health Risk and Community Needs Assessment self-reported their health as fair or poor. Yet risk to one's health by lack of transportation to get to their medical appointments, difficulty filling out medical forms, and food insecurity detract from one's health. It is noteworthy that some social determinants cross different domains of the social determinants. For example, food insecurity can be driven by not having funds to purchase food, lack of transportation to a grocery store, or lack of access to a grocery store in a food desert. Limitations to the secondary data set used in this study include the fact that these are self-reported data and reflect a snapshot in time. Further studies should explore more specific social determinants of health and their association with individuals' perception of fair or poor health. In addition, more analysis should focus on health disparities for segments of the population. The Healthcare Advisory Board noted that it is insufficient to focus on the medical and biological determinants of sickness without addressing root causes of poverty and inequality which drive risk from social determinants. Based on the 17.7% of respondents who reported their health as fair or poor in the population of Allen County at the time of the survey, 79,189 people, the extrapolated number of adults who have fair or poor health is 14,016 people. Based on our sample size of responses for fair and poor health only being 99, it sometimes seems insignificant, but 14,000 Allen County citizens with fair or poor health is a significant number. This study found associations between individuals' self-perception of fair or poor health and measures of economic stability, educational attainment, social and community context, healthcare, and neighborhood and the built environment. These findings will be useful for the preparation of the next Community Health Improvement Plan.